Good afternoon. My name is Lucy Aquino, Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. And today, this program comes to you by CAN TV Cable 21. During the next 25 minutes, we're going to be discussing heart disease-related emergencies. We invite you to call in with any questions that you may have. The number's at the bottom of your screen, area code 312-738-1060. Joining me today is Dr. Pilar Ortega, Doctor, Emergency Room Physician at Illinois Masonic Medical Center. Allow me to welcome you to the show and thank you for coming.
Thank you. Thank you for inviting me. It's a pleasure.
Well, I know that this discussion today is going to be very interesting. So, Dr. Ortega, it's statistically, when we talk about death and heart disease and stroke, in the United States, stroke is the fourth leading cause of death, killing over 133,000 people each year, and the leading cause of serious long-term adult disability. Huge statistics, large numbers. So, and stroke is one of those things that can occur and happen to anyone, regardless of sex or age or race, and it can happen at any time. So, Dr. Ortega, when we talk about stroke, it's really about heart disease. So what is heart disease?
That's right. So heart disease is actually a disease of the blood vessels, not so much a disease of the heart alone. Basically what happens is that the blood vessels become clogged with layers of plaque, cholesterol, that causes over time blockage in the blood vessels. It can cause hardening of the blood vessels, and it can affect blood vessels in many parts of the body. So when these blockages occur in different parts of the body, it produces different symptoms and different diseases. And one of those is stroke. So that's when it affects the blood vessels in the brain. It can also affect blood vessels in the heart. It can affect blood vessels in the kidneys. So all over the body, you can see the effects of heart disease, which really ought to be called more maybe cardiovascular disease to show that it's really a disease of the blood vessels itself.
So when we talk about heart attack and we talk about stroke, it's really two different things, though. Can we kind of talk a little bit about what's what?
Sure.
What's a heart attack and what is a stroke? What's the difference?
Absolutely. So when one of these blockages affects some of the major blood vessels or arteries in the heart, that causes an area of the heart to lose oxygen. So some of those blood cells that rely on that artery in order to get oxygen are no longer getting oxygen. And that starts to produce some of the symptoms of a heart attack and progresses to a full heart attack, which includes the death of some of those cells in the parts of the body. So on the other hand, if that happens to some areas of the brain where some of the blood vessels that supply oxygen to an area of the brain becomes clogged up or suddenly blocked by these plaques of cholesterol or clot, then what happens is a stroke. So it's essentially the same underlying disease process, but in a different part of the body.
Wow. And it really does, I mean, there is really a difference between the two. So, and just like the difference between the two, there's also different symptoms and signs for each of those. Can we talk a little bit about those?
Sure. So when a part of the heart, let's start with that, with a heart attack, when a part of the heart gets deprived of oxygen, the most common symptom of having a heart attack would be chest pain. And this can come in various varieties. For the most part, people experience a strong pain that starts kind of mild in the middle of their chest and feels, can be described as a tightness or a pressure-like pain. For some people, it's more of a, not really a pain, but more of a tight discomfort. Different people will describe it in different ways. And as the pain progresses, it can be associated also with shortness of breath. It can be associated with a feeling that you're nauseous. It can be associated with just generalized weakness or fatigue. Sometimes the pain can feel like it's moving to different parts of the body. For example, it can be felt in the jaw area or the neck area, sometimes down the right or the left arms. So different people can have one of these symptoms, can have all of these symptoms, or, a few of them.
So does it generally start in the middle of the chest, or is it something that can start in the arm first?
Well, different people actually present differently. So although the most common symptom is definitely pain in the chest, that radiates to an arm or another part of the body. Occasionally, some people don't have as significant a chest pain symptom, and they may just present with pain, let's say, in the shoulder area or the arm, and they may never really feel that pain in the chest.
Wow. Viewers, we do have a call. Caller, you're on the air.
Yes, and good afternoon, ladies.
Good afternoon.
How you doing? I'd like to ask the doctor a quick question. Well, two parts of a question. Number one, I remember hearing or read sometimes in a human being's lifespan, they have many, many heart attacks or strokes by the little pains that you will have in your chest. That's number one. Is that true or not? Number two, I always heard if you said that you got heart pains, it's a great possibility it's gas. They said if someone say if you got bad gas, 9 out of 10, hurry up and get to the hospital. But trust me, I'm one of these crazy men. If I had pain, I'm getting there quick. I don't care what it is. I'm not no doctor, so I need to have a doctor to tell me what it is. But let me tell you, a hell of a good topic. I appreciate you being on the show. Let me get off the air I can hear your response. And thank you for taking the call.
Thank you for the call, caller.
All right. So if I understand correctly, the first question, yes, it is possible for individuals to have multiple heart attacks or multiple strokes over the course of their life. And some of them can be fairly minor, and some of them can be more major. So it is possible to have some small blockages in your heart that only affect a small area of the heart. It can be possible to have small strokes that affect only small areas of the brain, and sometimes even resolve on their own, or with adequate treatment, get resolution of your symptoms to the point where you can save that heart muscle and you can save that brain after having suffered a stroke or a heart attack. So yes, it is possible for people to have multiple in a lifetime. Now, over time, they do tend to take their toll. So if you do have multiple of these events, it does weaken the heart muscle over time. And to answer the second question, it is true that indigestion type symptoms, gas-like symptoms, can sometimes be an equivalent for some people of that feeling of chest pain. So like I said, some people don't get the super classic chest pain symptoms that we sometimes come to expect as a lay public as far as what symptoms you would have if you were having a heart attack. Some people just have a more mild discomfort or a feeling of gassiness or bloating or indigestion.
So, as the caller mentioned, and it was a great question because these are some of those questions that a lot of people really don't ask. So, that being said, if someone feels they really do have a gas buildup or it is a chest pain, run to the ER?
Yes.
Go to the ER?
Yeah, so I think if you have something that is unusual for you, if you're somebody who tends to have bloating or gas after eating particular foods or something, and it's within what you're used to having, then that's probably a normal symptom for you. But if there's something different for you, if you're feeling an unusual discomfort in your chest or even upper abdomen, perhaps also if you're feeling weak or if you feel like your breathing is not quite right. If something is not quite right, it's a new symptom for you that you've never had, then it could be potentially concerning for heart disease or heart attack.
Absolutely. Go to the emergency room. Now, Dr. Ortega, also symptoms, if I understand correctly, also different for women than they are men, or could be. Can we talk a little bit about that?
Sure. Yeah, there's a few populations actually who tend to have less typical chest pain symptoms when they're presenting with a heart attack. One of those populations is diabetics. And the way I like to explain the problem in diabetes is the heart, like any muscle, is surrounded by some nerve endings. And like any muscle, if you overwork it, those nerve endings start to give you a cramp in your muscle, let's say if you're doing weights or something like that. So the same with the heart. So if the heart muscle is being overworked, or if a part of it is not getting oxygen because you have a blocked or narrowed artery, then those nerve endings are going to respond to the lack of oxygen by giving you a sensation of pain or discomfort. However, everybody's nerve endings works a little bit different. And for people who have diabetes, they have a problem with nerve endings throughout their body. That's why they have trouble with sensation in their feet or their hands.
Right.
And so when they are developing a heart attack, they may not have as good a sensation because their nerve endings may not respond quite as well to that lack of oxygen in the heart. So they may not have the same chest pain. So they may instead have more atypical symptoms like just some nausea, maybe indigestion, maybe just weakness or shortness of breath. So we as medical professionals in the emergency department evaluate patients with risk factors like diabetes a little bit more cautiously, even in the absence of chest pain, and to consider whether a heart attack might actually be part of the problem. And yes, women, for reasons that are not quite well understood, tend to have less typical symptoms than men do, as well as elderly populations have less typical symptoms than younger people.
Now, and that, I mean, because you hear this all the time, so obviously it's something we want to pay attention to. So ladies, if you're not sure, follow up with your physician. Go to the emergency room. Don't delay. If you're questioning something, please. It's not you. It's not something you normally feel. Please go to the emergency room. So, doctor, there's also this big thing out there. There's a silent heart attack. You know, you hear it a lot. Oh, he had it was a silent heart attack. There was no signs, no symptoms. It just happened. What's that all about?
Well, I think that's precisely what we're talking about. So I think when people come in with symptoms that are anything but chest pain and are found to have a heart attack, that's what we call a silent heart attack. There was sort of no warning in the sense that the warnings that we typically consider to be warnings for a heart attack, which is primarily chest pain, was not there in that case. So that's what people refer to as a silent heart attack.
So going back, now we talked a little bit what are the signs and the symptoms of a heart attack and a silent heart attack, but there are also signs and symptoms for stroke as well. Can we go over those?
Absolutely. So the brain, when part of the brain is deprived of oxygen because of a blockage or a stroke, it can cause any number of symptoms. So the symptoms for a stroke are actually much more varied, depending on what area of the brain is specifically deprived of oxygen. So for example, if the part of the brain that's affected is the part that controls the movement of your left leg, then you're going to find that you're having trouble moving your left leg, or perhaps when you get off the bed to walk to the bathroom, you may find that you can't walk very well, or that you're sort of leaning towards one side to walk, or you have to grab onto the wall. So that would be one example. If, for example, it affects the area that moves your right hand, and let's say you're right-handed, and you notice that your arm maybe feels heavier, that you can't pick up a pen to write quite as well as you usually do. On the other hand, sometimes it's not these movement difficulties that people have, but more of a problem with their speech. So if it affects, for example, an area of the brain that controls your ability to move the muscles in your face, then you might notice that your part of your face is drooping, and sometimes it's a family member who's going to notice that the face doesn't look quite the same on one side, and your smile may not be quite the same, or that your speech is coming out garbled or slurred because you can't control your tongue as well. And other times it's your ability to come up with language, which is a different area even than speech itself. And so people might have trouble finding the right words, or they might feel confused, or they might not understand the words that other people are saying to them.
Right.
So there's quite a variety of symptoms that people can have
Easy
with
to
stroke.
identify with, obviously. I mean, these are symptoms that it's something that's not normal. It's you see it happening. Even if it's one of those, it's time to go to the ER.
Absolutely.
Absolutely. Call that ambulance. Get over there as soon as possible, ASAP. Now, just as there is a silent heart attack, there is such a thing as a silent stroke as well, isn't there?
That's right. There is. Sometimes what happens is that the stroke it affects such a small blood vessel that feeds a very small area of the brain, and so there is enough other blood vessels that are providing oxygen for the brain that you don't notice any symptoms at that time. So you may have absolutely no symptoms, but just by virtue of having heart disease or cardiovascular disease, some of your blood vessels, the tiny ones, have been over time affected and blocked off. And sometimes people don't get any symptoms of this until years later when they've accumulated lots of these little insults to the brain. And then there's also what's commonly known as a TIA or mini stroke. And the TIA stands for transient ischemic attack. And what we talk about with these is that the symptoms of a stroke are there, but they only last a short period of time. So they seem to resolve on their own. Let's say you had trouble moving a leg or something for an hour or so, but then it just seemed to go away on its own. And what happens with those is people often say, oh, well, it went away on its own. It must have been nothing.
Right. They ignore it.
Exactly, and they tend to ignore it. But actually having one of these small strokes can be a sort of warning sign that you may have a big stroke in the near future.
Right.
So you're higher risk for having a more significant stroke in the next 2 to 3 days.
Oh, wow. So that is it's a calling. Don't ignore it. Follow the signs and symptoms. Follow up with your doctor and go to the emergency room right away. We do have a caller. Caller, you're on the air. Thank you for calling.
Hi, thank you. I had a question. I have a loved one that has dementia, and some of the symptoms that you described in the stroke are symptoms associated with her dementia, and she does have high blood pressure. So I just want to know if you knew anything that I could look out for in terms of symptoms that may be, I mean, she has some of the things like forgetting words, speech sometimes, but are there other things I should look for in case there is a stroke that may come about?
Sure.
We'll answer that call for you, caller. Thank you for the question. Very
you.
important. Thank you. Doctor?
Sure. So actually, one of the answers to your question is that it depends on what the cause of your loved one's dementia is to begin with. So dementia is one of the things that can affect the cognitive functioning of the brain. So things like coming up with words and understanding what other people are saying to you are all cognitive functions of the brain. And one of the forms of dementia that is very common is called vascular dementia. And the reason it's called vascular dementia is because it is due to cardiovascular disease. So it is secondary to having multiple of these sometimes silent strokes over the course of many years. And eventually it causes you to lose certain cognitive functions of your brain. So things that I would look for in somebody who already has been affected by dementia, either of the vascular type or of another, would be any change in that particular person's cognitive status. So you are the best equipped as your loved one's caregiver or family member. You're the best equipped to know what his or her baseline cognitive status is. So it's extremely helpful if, for example, you are concerned that she is now much more confused than she normally is, or is not able to do the typical things that she normally is able to do independently, let's say. You may not be able to identify the cause, and it may just be a general weakness that you notice, or an inability to do her usual activities or to respond to you in the typical way. But whatever it is that you notice is out of her normal function, that would be a good time to call her physician and see if there is a reason why perhaps you should go ahead and go to the emergency department with her, to basically, and to have that information with you for us, the emergency providers, in terms of what her baseline status is, because that really helps us a lot in order to be able to assess what the change has been and what the causes could be. With individuals who already have had stroke or dementia that have significant disabilities from it, sometimes something as simple as a urinary tract infection or some other thing going on in their body can bring out the deficits that they had before but have improved.
Right.
So
that's a great question. Thank you, caller, very much. We do have another caller on the line. Caller, you're on the air.
Yes, this is that crazy man called you earlier. A quick question. These are two things I do not want to leave God's green earth with. I don't want to have no heart attack, and I don't want to wake up one day and don't know who in the heck I am. I always was told there you could do, we do everything. We work on everything on our body except our mind, our brains. They say the best thing to do is read and write and look at quiz shows and things to keep on trying to use your brain. And they say if you do that, there's a great possibility that you won't have that problem. I want to know, is that true? And you see a lot of info commercials talking about take this pill, you won't never forget your name. You can remember something 100 years ago. Do that stuff work in it? Because like I say, there's some things on God's green earth I don't want to leave here with. You know, I would like to always know who I am. And when my last breath, I would like to say, baby, I'll see you later. So please, can you tell me, is anything that we could do?
Thank you, caller.
Well, that's a great question, and it does bring us to the topic of prevention, which I think is really important, because obviously we want people to come in when they have these symptoms and problems, but even better would be to prevent them in the first place.
And that's a good segue to this, as a matter of fact. And we are having a program Saturday, May 10th, on prevention of heart disease and stroke. And registration is available, so you can call. This event will be held at Advocate, Illinois Masonic Medical Center at 836 West Wellington here in Chicago, near Wellington and Hostet in the Center for Education building. For those of you who are interested in coming, please call. Seating is limited. Free screenings will also be provided that day. So 1-800-3-ADVOCATE, you can call, or 1-800-323-8622. Again, 1-800-323-8622. Or you can call Hispanocare at 773-296-7157. Please mention code 9C66 for a Spanish presentation, or the English presentation, mention code 9C68. Again, that program is on prevention in heart disease and stroke, Saturday, May 10th. We invite everyone to come. Programs will be set up both in English and in Spanish with Q&A, as well as light breakfast, screenings, blood pressure, cholesterol. Please come out and join us and come and learn a whole lot more. So, Doctor, I think we have enough time for one more question. Our time here goes by so quickly, and this topic is just so important and so educational. We wish we can just continue to do more. So, last note, when should you go to the emergency room? And we've got less than 1 minute.
Okay. So basically, if you have any symptoms that for you are different, that are unusual for you, particularly related to pain or discomfort in your chest, or any symptoms of the stroke that we mentioned, for example, weakness in part of your body, inability to think as you usually do, or inability to speak as you usually do, those would all be definite signs to bring your loved one or yourself to the emergency department or call 911.
Wow. You got to come back. I mean, there's just so much more to talk about, and I extend another invitation to have you back so we can pick up where we left off. So much more to share. Thank you for the callers with their questions, very important questions. On behalf of my colleagues at Hispanocare at Illinois Masonic Medical Center, Dr. Pilar Ortega, thank you so much for coming out and for sharing this important information with you and allowing us into your living room. Thank you. So, my name is Lucy Aquino. I'm with Hispanocare, Program of Advocate, Illinois Masonic Medical Center. I'd like to thank you for watching CAN Cable 21. Until next time, we invite you to stay tuned for a lot more information coming your way. Until next time, have a good evening.